I'd like to thank all of y'all for coming today to listen to my speech that I'm giving about active listening. And in the United States, we pride ourselves on having the best healthcare system in the world. But according to the World Health Organization, the United States is ranked as 37th and the lowest in industrialized nations. Could something be done to help improve our ranking in healthcare among other industrialized nations? The answer is definitely yes. I'm talking about the importance of active listening when caring for patients in a hospital or in a clinical setting. The skills and techniques I'm going to talk about today are helpful in everyday communication as well. According to Dr. Charles Denham, the art of listening, really listening, is foundational to clinical practice. When you listen, it's a demonstration of respect, and listening in itself is a healing practice. As a nurse working in a busy clinic, seeing sick patients every day, I have come to realize that active listening skills help me to better understand my patients' needs. If I'm not giving my full attention to my patients as they describe to me their problems, I could miss something very important that could make the difference in a positive or negative outcome for them. Today, I'm going to share information with you about what active listening is and the importance of using active listening skills when caring for patients in the healthcare field. We will learn why active listening is important. We'll learn the purpose of active listening, and we will talk about techniques that help us be better listeners. First off, we will talk about what active listening is. Understanding what active listening is. According to Joan Klagsbrun, adjunct professor at Lesley College in Andover Theological School, active listening is reflecting back the essence of what the patient's saying to you. It's a way of listening to feelings and becoming aware of body sensations that carry meaning about issues or concerns. According to Julie Ann Morath, RN, Chief Operating Officer at Children's Hospital and Clinics in Minnesota, she says, when you fail to listen, the patient and their family have not had the opportunity to tell their story. And when you've missed that opportunity, there's a sense of loss and emptiness. The 1999 Institute of Medicine study, To Err as Humans, cited that between 44,000 and 98,000 people die every year in U.S. hospitals because of medical errors. Many believe the numbers are far greater and that much of the problem stems from communication errors. In 1999, a medical study examined medical mishaps in which 26 residents at a 600-bed teaching hospital reported a total of 70 adverse incidents. The most commonly cited contributing factor was some aspect of faulty communication. When caregivers fail to listen and communicate correctly, errors can occur that can lead to real harm and death, as in the case of a little 18-month-old Josie King, whose mother Sorrel tells this story. Little Josie was in a hospital in the United Kingdom, and caregivers failed to communicate changes in doctor's orders regarding a medication for the child. The doctor had changed the order from intravenous to oral fluids. The mother, Sorrel King, tried to tell the caregivers, but they failed to listen. And when she voiced her concern, the wrong medication was given to the dehydrated child, and it resulted in her death. That's from the Journal of Patient Safety. So now I think we all have a good idea of how important active listening skills are when caring for patients in the hospital or clinical setting. Listening and communicating well with our patients can literally prevent adverse events, including death. Now we can work on ways to be better listeners by using these techniques that I will discuss. The purpose of active listening. Really hear and understand what your patient's message is. Promote the expression of what the message and feeling of what is being said. Let the patient know that what they are saying is very important. Confirm to the patient that what they are saying is valuable. Allow the patient to hear their own message through feedback. Physical skills you can use while listening. Face the patient when he or she is speaking to you. Keep an open posture and don't cross your arms. Do not cross your arms. Lean towards the patient to show interest. Look at the speaker using direct eye contact. Be comfortable and relaxed. Do not fidget. Create a comfortable environment for the patient speaking. These are some following skills while you're listening to your patient. Do not interrupt the person speaking. Do not ask too many questions to the speaker. Do not make too many observations. Let the speaker finish talking and let them tell their own story. Use prompters like, yes, go on, I understand. Nod and show signs of being attentive. Allow time for silence. Allow the speaker to talk next. We have talked about techniques we can use to become better listeners. Now we will discuss how communication is a two-way street. These are some important factors that help facilitate effective communication. Use professional and respectful introductions while communicating. Formally address the patient by name. Establish trust with the patient. Consider the environment, modesty, emotional and physical needs. Above all, keep patient confidentiality in mind. And when communicating with children, the interview must be age appropriate. Kneel to be on the child's level. Involve the parent or the caregiver in the interview. When communicating with the elderly, and we're very glad we have two very special people with us today, remember that aging is different with all patients and not all elderly people have hearing or sight impairment. Give the patient the time needed to explain his or her main complaint. Verify information with the caregiver or family member when needed. Remember these important things. Practice listening skills. Do not judge others. Show kindness, compassion, and empathy to all patients of all ages, cultures, and those with special needs. Understand that basic communication skills are essential to healthcare workers. Now we're all informed on great techniques to help us all be better listeners. When caring for our patients, and we all understand the importance of active listening, I will now speak a little on the development of trust. According to Kristen Lambert, RN, PhD, it is important for the nurse to establish the therapeutic relationship and begin the task of developing trust. Identified core qualities of a therapeutic relationship are trust, empathy, respect, authenticity, seeking clarity, and active listening. Today, we have discussed the importance of active listening when caring for our patients and the techniques we can use to help us be better listeners. These techniques will help all of us become better caregivers overall and help the patient feel respected, valued, and cared for. Everyone wants to be heard, and in the healthcare field, active listening by the caregiver can mean the difference in life and death for the patient. Thank you for your attentiveness.